This is Live Well, and today we're speaking to the gents of the African continent. November is Prostate Cancer Awareness Month, and today we're unpacking the link between prostate cancer and erectile dysfunction. And we'll ask how men can rebuild both their health and their sense of self after a diagnosis and treatment. We're joined on the line by Dr. Viola Morolo, who is a specialist urologist helping us on this one. Dr. Viola, thank you so much for your time. Good morning.
Good morning. Thank you for inviting me, and it is my pleasure.
It is a pleasure.
I do want to apologize for the delay. I was in theatre, so I apologize to your listeners and your team for delaying.
We completely understand. You are at work after all. We appreciate you spending some time with us. We won't have as much time as we had for the conversation, but let's speak about these two. Prostate cancer. Could you give us a brief on what exactly this is?
So prostate cancer is a cancer, which means it's a growth in the body that unfortunately then spreads to other organs and causes essentially the body to then become weak, and sometimes has, especially prostate cancer, detrimental effects on functioning. For example, you may end up with paralysis if it spreads to the bone, and other areas that prostate cancer spreads to the lungs and to the liver. And the reason why there's a lot of focus on prostate cancer in Africa, sub-Saharan Africa and South Africa, is because prostate cancer is the most diagnosed cancer among men in sub-Saharan Africa and South Africa. So it's a cancer like all other cancers, but specifically it's in the prostate, which is an organ that lies below the bladder. Prostate itself has got a very important role to play in terms of fertilization. It contributes to the viability and the health of the sperm, and so it's an important organ. But unfortunately, if a cell then outgrows and goes on its own autonomous growth, then it causes problems, and thus it results in cancer.
Let's talk more on that. I mean, the cancer in itself, how does it actually develop in that part of the body? Do we know the causes behind it?
Okay, so cancer in general is when a cell mutates and becomes different to the original cell. So all cancer cells essentially were normal functioning cells, and then they mutated, means they changed shape and form, and then started functioning outside the original reason why they were formed. The cell was already formed. And so when a cancer then becomes, almost like unlike what it was planned to be, then it causes disruption in the organ, and there are many reasons why it can be, what can cause it. The most common reason is where we don't even know why the cause is, where it's non-hereditary, means sporadic cancer formation. But there are reasons why a patient can then have a hereditary cause for the cancer, where there's a family history, especially of prostate cancer or even breast cancer. So prostate cancer is also related to a family history of breast cancer. And those are the familial causes for prostate cancer. But as I mentioned, by far the majority is where there's sporadic cancer formation, where we don't really know what the causes are. On the familial side, there are genes that are associated with prostate cancer. So I always tell my patients, those that are diagnosed with prostate cancer, that they must communicate to their family, because then their family must obviously start their screening as early as possible from the age of 40, and obviously those without risk factors is at the age of 45. But in terms of risk factors, it's a family history, like I've mentioned, and age. As you grow older, the body is not as swift in removing cells that are not now behaving like the normal cell, because inherently the body is made to pick up cells that are becoming abnormal and actually kill those cells so that they don't cause damage to the body. Now, as you age, that system then is not as agile and as efficient as it is when you're young. And so these abnormal cells then accumulate, and that's how cancer forms. So age is a risk factor, but by far the biggest risk factor is family history. And yeah, that's why people should always screen earlier when there's a family history, or when they're getting when they're more than the age of 50.
Now, let's speak about this correlation that we're focusing on today, the correlation between prostate cancer and erectile dysfunction. It's a conversation that many men don't want to have because speaking about, dysfunction of men's sexuality, they don't talk a lot about this, but there could be a direct correlation. What is that correlation?
Absolutely. So, erectile dysfunction, one of the causes for erectile dysfunction is hormonal. So, we've got a mnemonic that is VENDA. Talks about the causes for erectile dysfunction. The V is vascular causes. The E is endocrine, which is hormonal causes. The N is neurologic, because a lot about erection is about the nervous system. And then the D is drugs or diabetes. And then the A is age. So those are the common causes for erectile dysfunction. Now, specifically, the relation with prostate cancer is that is the neurological part, because unfortunately one of the side effects or complications from one of the treatments for prostate cancer is when there's nerve damage. The prostate is positioned such that there's nerves that run behind the prostate, and those nerves play a crucial role in erection, sexual functioning. And so when we operate and we damage those nerves, then it has an impact on your erectile functioning. So unfortunately, that's one of the the disadvantages about treatment for prostate cancer. One of the treatments, I should say, for prostate cancer, because then you're at risk of having erectile dysfunction, simply because of the anatomical position of the nerves that are then also important for erectile functioning. So, and that's the reason why screening is so important for prostate cancer, because normally when we catch the cancer in time, we can do a procedure that we call nerve-sparing prostatectomy, where the cancer is still early, and then we're able to remove the prostate in such a way that we stay clear from the nerves that are then important for erectile functioning. But unfortunately, when you've got cancer, the priority is for oncological control, meaning making sure that you're clear of the cancer. But when the cancer is early, we can do oncological control, but still ensure that we save your nerves so that you still have erectile functioning.
As we wrap up, what would the treatment involve?
Sorry, can you just repeat the question? I didn't hear you.
What would the treatment involve?
For erectile dysfunction?
For prostate cancer and for both. I mean,
okay.
in the case of prostate cancer.
So for prostate cancer, the treatment is a vast treatment. And remember, when we go to treatment, it's always about shared decision-making, meaning the options are discussed with the doctor and the patient, and together we reach an agreement what is the best option for this particular patient with their circumstance. So treatment is normally divided into localized disease, meaning the cancer is only confined to the prostate, or locally advanced disease, meaning the cancer has spread to the local organs, or metastatic disease, meaning now the cancer has spread to other distant organs, for example, like I mentioned, bone, lungs, liver, and so forth. So when it's local, and there's various treatment options in all those three categories. So in terms of bigger picture, the localized disease can be treated where we can give radiation only in the prostate. We call it brachytherapy. Or we can actually take the prostate out, do a radical prostatectomy. And even with the radical prostatectomy, where we take the prostate out, there's various options. We can do it open, which is not, done commonly these days. We can do it laparoscopically, or we can do it robotic. Robotic is obviously the global gold standard, where the added advantage of making sure that we also spare the nerves and ensure your quality of life in terms of erectile functioning. Okay. And then the locally advanced prostate cancer, we can then do radiation. Normally it's multimodal. We can give you radiation, or we can combine radiation with the radical prostatectomy that I mentioned earlier on. And then the metastatic disease is obviously now spread to other organs, so you need systemic treatment. And there we target bringing down your testosterone, because remember I mentioned testosterone is it actually plays a crucial part in prostate cancer progression. So when we've got metastatic disease where the cancer is now spread to other organs, the aim is to then decrease your testosterone so we can decrease the progression of the cancer.
Okay.
And that's where then the erectile dysfunction also is made worse.
Okay, we have to leave it there. We've run out of time, but you've helped us a lot on this one. Thank you so much, Dr. Viola.
You're most welcome. It was my pleasure. Thank you so much.
That's Dr. Viola Morolo, who's a specialist urologist, helping us on that awareness for November, which is Prostate Cancer Awareness Month.